Good afternoon. Thank you for coming to the final Wheelhouse Talk of the 2014 semester. It's hard to believe we only have a month left of classes. Seems like just yesterday it was nice and sunny out, and now we have snow. My name is Nathan Mahmoud, and I'm a third-year fellow. I'm also part of the executive committee, along with Dana and Singy. The 2014-2015 Wheelhouse Talks feature cross-disciplinary local leaders who are eager to share their philosophy and experience. Leaders of today and tomorrow come together to evoke stories of triumph, tragedy, tradition and innovation, and conflict and collaboration. Through the series, shared leadership values, responsibility, energy, community, and authenticity are center stage, all with the creation of a shared vision of community. I will now pass the microphone on to Zingy for the introduction of Dr. Pickut.
It's my honor today to introduce you to Dr. Barbara Ann Pickut. As Medical Director of Parkinson's and Movement Disorders at Mercy Health, Hauenstein Neurosciences, and Associate Professor at the Michigan State University College of Human Medicine, Dr. Barbara Pickut is a standout in the Grand Rapids medical, neuroscience, and academic communities. A graduate of the University of Michigan for her bachelor's and master's degrees, with an MD from the University of Antwerp, Belgium, Dr. Pickut has completed 38 clinical trials in Parkinson's disease since 1992. She also co-founded the Belgian Movement Disorders Society and studied the role of mindfulness and mind-body intervention in movement disorders. She also conducted the first known study on Parkinson's and MRI, or using MRI in behavioral studies, I believe.
That's right.
Behavioral data. Please join me in welcoming Dr. Barbara Ann Pickut.
Thank you. Thank you. So, hello everyone, each and every one of you. Thank you for your attention and for coming to listen to me today. I'm sort of small, so I think you'll hear me better if I stand up here, right? Okay. Good to see you all, smiling faces. We're here to talk about mindfulness and Parkinson. Do you not hear me? Thank you. I have it signed that my voice isn't loud enough. That better? I will speak up a little bit as well. And please, if anyone doesn't hear me, just raise a finger. All right. So my perspective on this huge topic, I think we can have a conference of a week long talking about these things. I will be speaking to you as a physician, as a clinician, as a neuroscientist, and someone very much concerned and involved with people with Parkinson's disease. This technique of mindfulness, if you allow me to call it a technique, finds itself amongst the complementary and alternative medicine. And these are mind-body techniques that look at the mind and the brain and how that affects health and behavior. And it encompasses things also such as spirituality, where we're allowed to speak about spirituality in medicine. There's a diverse group of therapies that are covered here, of course, things like meditation, yoga, tai chi. And all of these techniques have some scientific validity. They are being studied nowadays, also in connection with Parkinson's disease. Now, my colleagues often ask me, why would you be interested in this? Why is a Western physician überhaupt interested in mindfulness and meditation? Well, part of it is driven by the questions that we get, of course. We know that patients with chronic diseases in general and neurological diseases in particular use more complementary and alternative medicine. This is known. In fact, the last U.S. Health Survey that was conducted in 2007 showed that 38% of adults and 12% of children have ever used complementary and alternative medicine. And in this survey of approximately 24,000 people, the people were asked, have you meditated in the last year or used meditation? And we see that in 2007 already, that 9.4% of adults and 1% of children have used meditation. We can only imagine that that number has grown. over the last years. So when we look at this subject matter and we're thinking about people with Parkinson's, we see that a survey in 2001 showed already back then 40% of people who were suffering from Parkinson's disease have turned to alternative and complementary medicine. So as far as I'm concerned, as a person who's serving people with Parkinson's, this is pointing to an unmet need. Is there research in this area? Yes, certainly. And you see here, sorry, I'm ahead of myself. You see here what we're trying to understand when we're looking at meditation in the cognitive neuroscience world. We're looking into the underlying mechanisms of different practices of meditation. We're looking at different traits and states of practice. The difference there is a trait of practice means that that's something that's lasting, something that you can measure outside of the actual meditation itself, whereas a state like is during the meditation. So people are looking both at what's happening during the meditation act and are there some things that are lasting outside of that. People are looking also at different stages of the practice, as well as what are the effects of this kind of practice over a lifetime. And this results in such a slide where you see an exponential growth of studies over the last years. This last data goes to 2012, and we expect that this trend will continue as we look into the literature. So when we study meditation, we will be specifically talking today about the mindfulness as an intervention, and I'll be explaining what that means. We would like to define what mindfulness is. It's a dispassionate, non-evaluative, continuous moment-by-moment awareness of sensations, perceptions, emotions, and thoughts. So I just did that, listening to how we all felt about this. So it's just being aware, becoming aware of what the sensorium is bringing you. Not to become alienated from it, but to have some room in it and to feel what there is to feel. So it's this idea of awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience moment by moment. And this is a continuum. We'll talk more about why. Why would you want to do that anyway? So let's talk a little bit then, if you'll allow me. What is mindfulness? When we see it all over the place. You see it on Time magazine covers. You see it commercials. You know businesses doing it. What is this all about? It's mindfulness training itself consists of 8 weekly sessions where people get together, the same group, 2.5 hours once a week for 8 weeks. The 6th week, there's an all-day session where the group is expected to attend. And what do people do in these sessions? Well, people are taught how to meditate. Now, I know everyone has their own idea about meditation, what that means. It's sort of a strange Eastern entity, or maybe it's become closer and something that some of us here are doing. Yoga says something to most people as well. It's seen a little bit as an exercise. The particular type of mindfulness that is done in the context of yoga that's done in the context of mindfulness is done with this present moment awareness as the body is moving. And then there's the body scan that looks a lot like a relaxation. However, it's sort of a sensory trip through the body, sort of a internal Jules Verne, where you just lay there and just feel what there is to feel, not wishing something different, not pushing something away, but again with a stance of that present moment, moment-to-moment awareness of what there is. Why would you want to do this? Well, in a way, we spend a lot of our life wishing something else, pushing away what we have. So we miss a lot of what's going on. Also, this type of training, the body scan, has been shown to train the sensory cortex so that we can use our body as a parameter of what is going on now. If I were to check in now, as we say, I could feel a slight tightness in my stomach, having to stand up here in front of you, which is totally normal. I could freak out on that. I could let my heart rate go up, but I could recognize it as well and leave it be as it is. It's part of being human. So there's also homework that is asked of people 6 out of 7 days a week, 45 minutes a day. People are asked to practice. And people practice using audio CDs where there's a meditation that's given, where there's 45 minutes of yoga, and where there's 45 minutes of body scan. And these follow the course, and people are told which exercise to do on a particular week. People also do informal training, homework. They practice mindfulness during everyday activities, or just noticing how mindfulness may manifest itself in everyday life. I'd like to make a shift now. I hope it's a gentle shift for you. I learned how to drive with a stick shift, so I'll use my clutch here. I'd like to talk a moment about Parkinson's disease. Probably most of us have been touched by this in some way. We would like to point out some of the unmet needs for people suffering with Parkinson's and might make some suggestions as to how mindfulness could be helpful. Parkinson's was first described in 1817 by James Parkinson, who described 6 people, and in his words, who had a resting tremor, a stooped posture, a gait disturbance, and diminished strength. And this is a copy of his essay that he wrote then. And for those of us who may not be familiar with Parkinson's disease, we might have a perception that everyone is the same that has this disease, that they all look alike. But if you look closely, you'll see that there is variation. And the clinical presentation of mindfulness is just as unique as every single person. It's never the same twice. And for one individual, it's never the same from day to day. Even still, we need to recognize what it is in the clinic, because we're going to have to identify it to be able to help people, to be able to prescribe medication, for example. So we talk about the cardinal motor symptoms, and these are tremor, rigidity, a certain stiffness of the muscles, a bradykinesia, that is a slowness of movement, and perhaps postural instability. We had to learn this in medical school as TRAP, so you probably will leave today remembering that. So these are the motor symptoms. These are the things that we recognize when we look at someone from the outside. We also know that there's a whole body of symptoms called the non-motor symptoms that are just becoming to be more understood. Actually, they were described maybe 30, 35 years ago. People were talking about non-motor symptoms. It became politically incorrect as physicians to talk about these non-motor symptoms for a while, and now it's a hot topic again. So they're not new, they've always been there, but the descriptions have changed, and we're allowed now, we're encouraged to speak about them. This is a non-exhaustive list of some non-motor symptoms, and the things that are underlined, maybe let them impress on your retina and take them up into your visual cortex. We will be pointing at them later. Things like attention deficits. So that, as well as depression, anxiety, and pain, those are non-motor symptoms that can come forth even before the disease is diagnosed. So some people have pain, constipation, attention problems, depression as heralding symptoms to Parkinson's disease. There might be fatigue involved in this, sleep disorders involved. There may be urological problems, hypotension, gastrointestinal issues, and weight changes, and the list goes on. So we became interested to see what we were confronted with and how we could carry this as a group. So when I was working in the Flanders, we looked at 215 people who came to our clinic and investigated to what degree they were carrying these non-motor symptoms. What we saw was that there was a high prevalence of non-motor symptoms in people who were suffering from Parkinson's. We saw that the median number of non-motor symptoms per person was 8. And we saw that at least 30% of people who had Parkinson's were carrying 12 of these non-motor symptoms. We also saw that people with mild Parkinson's already reported a considerable amount of non-motor symptoms, with pain and sweating being on the forefront. And we saw that these non-motor symptoms had a tendency to... You have a problem, Houston? Okay. Non-motor symptoms have a tendency to increase with disease severity. So why is the detection important? I'm sure you feel with me, having said what we just said, that there is an urgency and an importance here to recognize these symptoms. We have a feeling that these symptoms may impact the quality of life of people with Parkinson's more than the motor symptoms. And this has also been published on by other groups. And what's very important is these non-motor symptoms, because they're not recognized, they're not brought to the clinic. They're not spoken about. The taboo is gone, but we don't know the connections. Some clinicians don't know the connections. Clinicians are not asking about these problems. So this link may not be laid. And what this results in is that the motor symptoms are like the tip of the iceberg, and the real disease burden is under the surface. So why might mindfulness play a role in here? How could such techniques help out here? Well, we know that Parkinson's is a chronic progressive disease, and although there are great strides being made, also here in Grand Rapids at the Van Andel Institute and Michigan State University, with whom we have the pleasure of collaborating, there still is no cure. We have drugs and neuromodulation techniques, thank goodness, to help us carry the disease, but even these techniques bring complications with them and might often result in a lowering of quality of life. One thing that interested us very early on, we offered mindfulness first in 2006 to people with Parkinson's, was that we heard people saying that when they were under stress, that there was an exacerbation of symptoms. For example, standing at the grocery line in the checkout with a long line behind, having to get that little change purse out of the pocket. That at those moments, tremor increased, the ability to find motor capabilities decreased, and then it was just a chain reaction. So we were looking for a way also to help people break that chain. Just like I said a few minutes ago, that the feeling in the pit of my stomach, recognize it and let it go. And then, coupled with that, of course, as we had said, a substantial amount of people with Parkinson's were already seeking alternative medicine. And we felt somehow a responsibility as scientists to look at that and to see what the consumer was getting. Finally, that there is some precedent that mindfulness may affect some of these non-motor symptoms. And you see them here. As we had said a few slides ago, pain, depression, attention deficits, anxiety, fatigue, quality of life have all been studied in the mindfulness literature, and there is some evidence that there's some alleviation of these symptoms using a meditative approach. Actually, the paradigm or the technique of mindfulness-based stress reduction was first developed as an intervention for chronic pain, and that was developed in and for a hospital-based population. So, given all that, we were at a place and had the opportunity to study this. So that's what we did, and we used neuroimaging to help us look at the brain and see how the brain might change. The first study you see here, we won't go through every study, but this study here from Sarah Lazar in 2005, that was the study that got everybody talking about when you meditate, your mind grows. So this was picked up by the press and whipped up, and it was brought as something very important, which it probably was, But it's not so much that the brain grows. We don't know how the brain changes. We don't know if it's more blood flow to certain areas. We don't know if it's that the neurons are making more connections or fortifying connections between them, or if there's some sort of change in this chemical soup that we're bathed in. Something is changing. What Sarah Lazar saw, this was a non-randomized cross-sectional study, and that will say something to a lot of you social scientists in the room. We don't know if the people in this study had a proclivity to meditation, if there was sort of a self-selection. But what she did was she compared age, sex, and education matched long-term meditators in Cambridge, Boston. So are those people normal? We'll leave that. We'll leave that somewhere. Comparing those long-term meditators to other age, education, and sex-matched individuals in the same population. And she found that the frontal lobe, where we normally have age-related atrophy, that the 40 to 50-year-olds meditators in that study had just as thick of a cortex as the 20 to 30-year-olds in the population. So, of course, people became very interested in this. But that's just the cortex. And what is the cortex? The cortex is that gray stuff. It's that ribbon around the brain. It's the actual nerve cells. Yes? So this doesn't say anything about the deeper structures. And why are the deeper structures important? Well, our limbic system, the system that is responsible for that flight or fight response, sits deeper in the brain. So with these techniques, we didn't see that. We have then a number of studies that followed that, and these were more of intense, advanced meditators. It wasn't until the work of Britta Hulsel here in 2010, 2011, where she was the first to look at mindfulness after 8 weeks to see if the brain changed. And indeed, in her population of people presenting themselves for mindfulness-based stress reduction, so again, read, are these normal people, people seeking stress reduction? Don't know, could be, maybe not. However, anyway, after 8 weeks' time, there were measurable changes in the brain. So we thought, could we also see those same kind of brain changes in brains that had to do with neurodegeneration? Could we offer this to people with Parkinson's disease and see some brain changes? So this is what we did. We measured the brains of people who had Parkinson's in a research paradigm. The inclusion and exclusion criteria are quite classic. I don't know what. And we, I wasn't going to read you the list anyway. Very classic, and in that, what I mean by that, these are the same inclusion and exclusion criteria that we use in clinical study for drugs. So, pharmacological, I don't know. You did it just then as well. So, well, there's pictures coming, so we have to see this. So we were able to include 30 people into our study, and we randomized these people, as it's said in this world, comparing them age, sex, and disease severity, and placed them into 2 arms, as we call it in clinical studies. One arm was an active intervention, so 15 people received the mindfulness training, and 15 people were in a wait list group. We offered these 15 people the mindfulness training later on, but they sort of functioned as our control, which I'm sure a lot of the social scientists again are saying, a wait list control. It has its negative points, which I'm happy to talk about in a few minutes. Did I break it?
I think it's trying to wake up again.
It's trying to wake up. Okay.
I just decided to take a nap for a second.
All right. Yeah, I should tickle it once in a while, I guess. Okay. So, and this we'll have to show, whether we get this up for now or not, I will just continue. I'll show you after. Oh, it's coming. It's doing the body scan, yeah. So we showed that, I mean, you know already that we showed after 8 weeks' time, we showed changes in the brain. What's interesting to mention at this point is it's not that the whole brain changes. There are specific areas in the brain that change, and areas that are perhaps relevant to Parkinson's disease. We know, for example, that there's a couple of areas of the brain, and this was one of our hypotheses going into this study. We see that some people with Parkinson's have loss of brain cells, not only in the basal ganglia and the substantia nigra, but also in the hippocampus and in the amygdala. This change is not only seen with people with Parkinson's, but also seen in people with post-traumatic stress disorder. People with post-traumatic stress disorder also have an atrophy of the amygdala. And the U.S. Defense Department is very interested in this because 15% of the people who come back from Afghanistan and Iraq suffer from post-traumatic stress disorder and suffer from amygdala atrophy. And the amygdala is part of the brain that regulates fear and anxiety. Fear and anxiety is an issue in Parkinson's, and of course, as you know, also an issue with post-traumatic stress disorder. So this is a very interesting entity. We're not up yet? So there are studies being done now with post-traumatic stress disorder and mindfulness. Amishi Jha, one of the great neuroscientists of our age, is conducting research trying to help veterans rehabilitate after their return. That's okay. We'll get back to it. So I have a slide here that shows you the differences in the brain. We'll come back to that. So you'll have to do it with my description of it for now. So those two areas of the brain. So the amygdala, important for fear and anxiety regulation. What we saw in our study, which is different than is shown in other groups, we saw an increase in the actual gray matter density of the amygdala, which is what we see in people with Parkinson's, people with PTSD. In the general population, read population looking for stress relief, we see a decrease in the volume of the amygdala. So there's some discrepancies here. We're not quite sure how the amygdala is working. The other important area of the brain that we see changes in is the hippocampus. The hippocampus was the first part of the brain that was shown in 2002 already to be able to create new neurons. Now, I don't know, we have a mix of population here in terms of age, but I know when I was sitting on the school bench, we learned you get your complement of neurons and that's it. You know, from 30, it's all downhill. So, you know, it doesn't seem to be that way. We know that the hippocampus can grow. This was shown also with taxi drivers in London and was measured that people who use their brains for specific purposes, like memorizing streets, their brain grew in the hippocampus. We know now that people who learn to play musical instruments or master some sort of particular way of being, that the brain grows. Not only in the hippocampus, but also the sensory motor cortex is changeable. And the real estate, for example, if you learn how to play piano, the real estate that's attributed to your hands is larger than someone who does not play the piano. this is positive plasticity. There's also negative plasticity. These things can go away. So the brain is something very dynamic, ladies and gentlemen. So that's one of the most important findings, actually, in the last 4 decennia in the neurosciences. The fact that the brain can be changed, that the brain can choose to change itself, is remarkable. And we're just learning. So this is a wonderful time to be on the school benches because there's a lot to do that I think really worthwhile to help people. So there are other areas of the brain that we saw in our study that Britta Hulsel did not see in her 8 weeks, and that is the caudate nucleus. The caudate nucleus is the site of dopaminergic therapy in Parkinson's. So when people take dopaminergic drugs, is that why you were clapping? I thought you were approving what I said. So, yes, wonderful. Thank you for your efforts. It's a sign of the modern times, right? So the yellow that you see here are the changes in the brain after 8 weeks. So we took the whole group, we split them in two. Half of the people followed mindfulness training, half of the people waited. And at the end of 8 weeks, we took a picture again of their brains, and we see that these are the areas of the brains that actually increased in volume. Okay, yeah. In the areas that I had told you about, our regions of interest were the amygdala, the hippocampus, for reasons we just said. We were down here to the caudate nucleus, the area where the dopaminergic drugs for Parkinson's do their job. That had also increased in volume. Another thing that I'd like to point out is the left occipital lobe. The left occipital lobe may be an early marker for dementia in Parkinson's. What we see is that when we begin to have atrophy in the back of the brain, that might herald dementia. So we also saw in that place in the brain an increase in volume. The thalamus is a little bit tricky. We know from stroke studies that when we have a stroke in the thalamus, that there can be apathy and changes in consciousness. But we're not really sure how that is pertinent to this study and to people suffering from Parkinson's. The next place in the brain that I'd like to tell you about is the cerebellum. What did we see in the cerebellum? We saw 2 areas of change. And I don't know if you can see this, but this is the anterior lobe, and this is the dentate nucleus. And this is, I think I'm going to make a Christmas card out of this year. This is an incredible image because you see here the dentate, you see the dentate, you see the tooth structure. So this was in the group of the people who didn't follow the mindfulness. And we thought, uh-oh, what have we done? What we think now is happening is that when we have Parkinson's, the cerebellum compensates. The cerebellum is, of course, the lower structure you see here. So if the cerebellum is compensating when we have Parkinson's and working harder, and we have an intervention that maybe is requiring less pull on the cerebellum, if we look at that 8 weeks later, maybe it's not that these people in the waitlist group had an increase in their cerebellum volume, but it was the people who followed the mindfulness who had less need to do the pull on the cerebellum. So that's how we're understanding that now, but it's remarkable anatomy. So, so what? You have a nice picture, your brain has changed. What does that mean? Well, we took behavioral measures, and this is now in review. And we saw that people who had followed the mindfulness were rated by a blinded rater. Everyone, the whole group of 30 was rated at the beginning of the study, blinded rater. And then after 8 weeks, the same rater rated these people in terms of motor function, and found that the people who had followed mindfulness had an improvement on their Unified Parkinson's Disease Rating Scale motor part. We had people do things like tap their fingers and move their hands. It's a standardized test that's been used for 30 years. We also showed on the 5-facet mindfulness questionnaire, which consists of 5 facets, one of them being observe, that the people who had followed the mindfulness, their capacity for observation increased. What also increased was the reporting of pain in the people who'd followed mindfulness. So that was another, what have we done? Probably the pain was already there and was unmasked in some ways, but maybe not. Maybe not. We need more time to study this. So in this study, we have indications of, and I would say indications, because this is the first study of its kind in the world. It needs to be replicated, that's clear. There are possible trait-like changes, so changes that are staying beyond the act of meditating in neural networks postulated to play a role in Parkinson's, which may have also been implicated in the functional networks mediating some of the benefits of meditation. So there seems to be some interplay here between networks of the brain that are involved in Parkinson's that are also touched in some way by meditation. So, of course, we'd like to know, as a physician, as a clinician, what we're offering, is that safe? I mean, that is like our first vow to be careful about that. And the mindfulness itself, that 8-week intervention, is generally considered safe. And these are the words of the FDA. Yeah? That is generally considered safe. Generally considered safe for healthy people, so we took maybe a little step on the line there. I must say in our study there were no adverse events, so that is important to let you know. However, people who start with mindfulness meditation may go on, and they may practice advanced forms of meditation. And there's a whole lot out there on the internet. I mean, you can keep yourself busy from morning until night meditating. And no guidance. No one helping you along your way when you are having some sort of unusual experience. And for me, that's a concern. There are 2 projects now ongoing. One is the Dark Night Project, where Willoughby Britton, who's a researcher from Brown University, is cataloging adverse experiences to meditation. Not mindfulness meditation, but to people who go off for months or weeks at a time and intensively meditate and maybe don't even speak to people for prolonged periods of time. There may be some sort of psychological makeup, or some people with psychiatric disease. There may be some sort of self-selection of people who are looking for these kind of interventions. And I think we need to be aware of this. And I think we need to talk about this. It's not a secret. And these things are just bubbling up now. There's another group working on the Contemplative Development Mapping Project where the spiritual journey is being mapped out. How we change. What are the landmarks? What can we recognize in such a journey? Very important work. Both things to find on the internet, by the way. So, I'd like to give you some considerations, and I'm going to tread softly, and I know I don't have a big stick, so tread with me in this. So we as neuroscientists, and now I get to put my white coat on and say, that's happening out there, but we are interested in neuroplasticity. So neuroplasticity, again, is something that has been around a while. Gage in 2002 showed that the hippocampus makes new cells. So since then, there's been an explosion. We know the brain can change. We just need to find out what the drivers are. We are learners. We're changing all the time. The fact that I see your face says, I'm changed. I will carry you with me when I leave here. How remarkable is that? What are the drivers? What makes us learn? What makes our brain change? I would postulate that meditation is a way to make the brain change. But we have to know what positive neuroplasticity is and negative neuroplasticity. There's also then the Buddhist perspective. And some Buddhist scholars are now saying, oh, this is a down-dumbing of Buddhism. And there's a precedent for this, actually. Medieval Zen Buddhists in China and the Tibetan Dzogchen Buddhists tried this already back then, making a simplified form of meditation for the lay person who could not lead a reclusive life. So there is a precedent here. And a recent article from Scharf, published in October 2014 online, he's a researcher from UC Berkeley, has put out Is Mindfulness Buddhist and Why It Matters. So his approach is to people who are now picking up this mindfulness, packaging it, selling it without really feeling the context behind this. I'll say. We also have the Christian perspective here. And if you'll allow me to say one sentence, mindfulness training is based on Buddhist principles. That says a whole lot, doesn't it? There are other Christian scholars who say, however, the fact that all major religions have a contemplative component must mean something. And who owns it? Yeah. Then there's the business perspective, the bottom line. Again, if you go out into the world, the electronic world, you find lists of businesses who are using mindfulness training in one shape or another for their employees. Is this bad? No, it's just the way it is. But not surprisingly, though, it's the tech companies who are leading the way here. And Silicon Valley is buzzing with mindfulness. We all know that Steve Jobs has taken some of his inspiration from Zen and his development in the Mac and the iPhone. What is, oops. Sorry. Yes. So what might be interesting, well, there's something I wanted to let you hear, though, first. I wanted to share with you a quote, but I have an override from the system, and I'm not able to get down to it. Wired magazine put out an article on mindfulness meditation in the Silicon Valley and talks about the data-driven forget the love and compassion, that this goes about the bottom line. So I think it's important to just pause a moment when we see this enormous growth of these techniques in business. On the other hand, we have people such as Janice Martirano, who was the attorney at General Mills, who is now the leader of the Mindfulness Leadership Institute. And she spoke at the Economic World Forum in Davos, Switzerland this year, and says mindfulness cultivates our ability to sustain attention for longer periods of time, to be in the moment in order to make clear decisions. Just as we now know that the body holds capabilities that can be trained to improve our physical resiliency, strength, and flexibility, we also now know that we can train innate capabilities of the mind to be much more focused, clear, creative, and compassionate. Compassion in business. Well, we chuckle, and I hope. I chuckle and hope at the same time. Why would we do something like this in business? Well, what could be the value here? Well, something about this more and more attention being paid in business to the individual as the building block of an organization, and that there's a certain resonance being allowed now for an individual transformation within an organization, sort of like a spider web, and that the individual is on the periphery, and if you tap that spider web, the whole web vibrates. So not any longer the idea of the individual in a little boat or bubble floating along, but some connection with a whole. And knowing that this might be important for an organization, because what is very often the interface between an organization and the outside world are the individuals. So this is being recognized more and more, and it's a good thing, I hope. So just to conclude here, 2 slides, mindfulness has been reported to produce positive effects on health and well-being in some study populations with neuropsychiatric disease. Further studies are needed, period. Further studies are needed to examine the possible effects of mindfulness training in Parkinson's disease and other groups using appropriate methodology. And I'm sure the scholars here today have noticed where the problems will be, and that's we need larger population size and validated control groups, that without a doubt. And I would like to leave you with the thought that the awareness, paying attention on purpose, as we've said, of the Western context in which mindfulness as an intervention is being offered. I would like to thank the people who participated in the study, the many friends that we left behind in Belgium, also the people who worked together on the study with us, and to thank you all for your attention today. Thank you very, very much.
We would now like to open the floor up to a couple of questions, but we ask, before you ask the question, can I give you the mic so that we can all hear you?
I'd like to ask, what were the small red bodies present in the cerebellum?
Those were 2 nuclei, as we call them in the cerebellum. What is a nucleus? A nucleus is a area where that we have the actual nerve cells. So in the brain, you have the gray matter and you have the white matter. The gray matter are the cell bodies, the actual neurons, the actual individual cell bodies. And out of that body comes long strings, and that's the white matter, that's myelinated, and they make connections to other parts of the brain. So what we're seeing here is gray matter density changes. That is to say that there are actual changes in the gray stuff in the neuron cells or the cells surrounding them. So those were two nuclei in the cerebellum that have to do not only with movement, but also cognition. Thank you for the question.
I'm question about the issue of how inflammation plays a role in Parkinson's, and are you, I think Dr. Brunei over at Van Annel Institute is looking at inflammation as a result tying into depression. Any comments you want to make about that?
Certainly. Thank you very much for the question. That there is a rather large body of literature about inflammation and mindfulness, if I may start there. One of the first studies showed that people who had immunizations, they took 2 groups, immunized everyone, and half of the people went on to study meditation and half did not. And the people who had meditated had higher titers of from the anti-flu vaccine than those who did not. That's one side of it. Another side of it is that we see that there are certain inflammation markers that increase with stress. So that is known as well. And those inflammation chemicals in the body can be deleterious to the nervous system. So I really think there's a tie in there. We measured cortisol levels as an indirect measure of stress. In our population, actually, we found no significant change. I think the methodology that we used was perhaps not correct. To study cortisol in the right way, you need to have more samples during the day. And for reasons of science in the real world, it wasn't done that way. But I think that that's very important, inflammation, and a tie into Parkinson's as well. Yes. Yes, sir. Wait.
I see a value maybe prophylactically in employing meditation, and I wonder if it can be verified statistically by looking at Buddhist monks, say in Nepal or India, and let's say 70 to 75-year-old monks who practice daily meditation vis-a-vis the general population just out in that country, in that locale. Yeah. Have studies like that been done?
Yes, indeed. Richard Davidson from the University of Wisconsin has been looking at Buddhist monks for quite some years now. And he's done a lot of the early work on neuroelectrophysiology using EEG, so electroencephalograms, and that study population, and has seen indeed that there are certain rhythms of the brain that these people have in a trait-like fashion. So not when they're meditating, but when they're just generally out and about, that their brain seems to function differently, that there are more gamma waves and less of the beta activity. I think maybe you're touching on something that I have no answer to, and that is, what is the incidence of neurodegenerative disease there? Yeah, that's not known, and I've thought about that myself. Maybe we could partner. That would be very interesting. I agree with you. Of course, how we live here and how one lives there are two very strong variables, I think. So, but I think you're pointing to the moon too. I'm pointing to the same moon. Thank you.
I'm wondering if the Parkinson Clinic over at Hauenstein is going to be doing any mindfulness training. And the second part of that is, do insurance companies cover anything like that?
Yes, very good question. Thank you so much. Yes, we're gearing up right now to offer this in a study paradigm. We were fortunate enough to receive monies from the St. Mary's Foundation, so we will be starting hopefully January, February, offering mindfulness to people with Parkinson's, and to see how this helps in another Western hook of the world. The last study was done in Antwerp, Belgium, so we will be doing that here as well. It is not yet covered in that way, third-party payers, but in a study, the people participate and do not pay. So that, yes, is the answer. There is some movement for health companies now, Aetna leading the way. Aetna has a mindfulness program online that costs $425 to follow. Mindfulness sessions generally cost something like $350 for the 8 weeks, just to give you an idea what the market value is. Yeah. So thank you for the question.
So I know we talked about the business aspect of mindfulness training and the awareness and perspective that people receive. Has there ever been any studies on mindfulness training in regards to like healthcare and hospital and patient safety?
Very interesting. Patient safety. Very interesting. Very interesting question. There is a growing interest for clinicians to follow mindfulness. I think sort of an indirect answer to your question is that when we as caregivers are burned out and stressed out, that more mistakes are being made. That's a given. You probably, I think, oh, you're a nurse. I was going to say, I think you know something here. I feel it. So yes. Also, what I personally, something that carries me is that going into a consultation room with a patient, being there, time after time after time, but really being there. Going out and there's somebody, how long was she in there? How long does it take for her to write a letter? You know, you got to deal with that. And then you have to turn on and be there again. And this kind of work helps you do that, I think. But that would be are you working in Grand Rapids? Come, let's do a study. Let's do a study. I think that would be very important. And, you know, that's the way the world works. We have to quantify these things to get the room to be able to do it. So, yeah, I mean it. Okay.
Okay, we have about time for one more question.
Oh, we'll have some coffee afterwards.
And I have a more personal question for you, and that is, well, it's twofold. Do you yourself practice mindfulness? It sounds like maybe you do, but, and the second part of that question is for the average public. You said that, of course, there are potential negative consequences if you're not practicing it in the correct way. But are there resources that you would recommend? And do you think it's a good idea for us to start practicing mindfulness on our own, or should we wait until it's more mainstream and part of a prescription?
You guys are asking really great questions. Thank you. Yes, I do use this type of work every day. Does it always work for me? No. Do I sometimes lose my cool? Yes, I'm a human animal, and that comes with being human. But it does help me in the clinic, again, to be present with people and not be busy with my own agenda. But there's something about open-heartedness, and this is something that I'm grateful to work where I work, because you can talk about love and open-heartedness. And it doesn't matter out of what philosophy, you're allowed to do that. How crazy is that? So I appreciate that, and I think the real human connections come out of this type of work. Do you have to do mindfulness to be that way? No, I don't think so. I think there's other ways to achieve that as well. There is a very good, if you're interested in mindfulness, there is a very good center here in Antwerp with two people, Grand Rapids, with two women who are very dedicated and very knowledgeable. Center for Mindfulness in Grand Rapids. They're wonderful people. So that's a place to knock on the door. Maybe I'm somewhat old-fashioned, and these online things, I don't know. There's something about being in the proximity. There's something that happens when you have pot-belly stoves all in one room warming up. It's different than one pot-belly stove in a big room. Maybe that sounds strange, but there is something. There's some... So, yes, and it depends on who you are. And that's one thing that I think, too, again, if I put on my white coat, we don't know what kind of brains respond to which kind of intervention. We're just starting to learn. So I don't know you well enough. Sure. We can have coffee together to recommend anything. But those are some options. I think that a certain amount of introspection, but it doesn't have to, there's a lot of, people get this from running, people get this from music, people get this from their church, people get this from their family. There's a lot of ways to touch the heart. And at the same time, practice, practice, practice. Yeah, thank you. Yes, sir. Oh, one last question.
One more question.
Last question? All right. Yes, it's a couple minutes, too. I'll be short.
We're concerned about the generations, our children and our grandchildren, because I don't think we really know what causes Parkinson's. Is there something that we can help them to do preventively so that they don't get it, or delay it, or be proactive in preventing it?
Very, very, very important question, sir. Most of the Parkinson, it's 99% that we see, is what we call sporadic. That means that there's no dominant inheritance from generation to generation. So the families that really have a strong genetic component are pretty much known in the world. So I think that aspect should be softened. Then again, everything we experience is on a genetic background. The fact that we're here means that we have a certain IQ that lets us be here. So there's a certain genetic background for everything, if you will. But again, most of it is sporadic. I think we need to look at environmental factors, pesticides, smoking, coffee, milk. There's a lot of things that have been implicated, and there's whole congresses about this. I think that stress is a factor, and that's been named. So if this should be an intervention that does have a positive effect on health, things like stress management, I think, are important. I hope that's somewhat of an answer. Thank you.
So with that will conclude the official Q&A.
Thank you.
And on behalf of the Hauenstein Center, we'd like to present you with a small gift and a token of our appreciation. Thank you so much for being here today.
Thank you. Thank you all.